Good evening, folks. This is Dr. Paul. Thank you very much for tuning to our channel today. Today, I want to talk a few minutes about the median nerve compression, the carpal tunnel syndrome. The median nerve compression is a common thing, the carpal tunnel at the wrist. The median nerve enters the hand through the carpal tunnel by coursing under the transverse carpal ligament. The symptoms include numbness, paresthesia, variably in the thumb, the index finger, the middle finger, and half of the ring finger. At times, the paresthesias can include the entire hand and extending to the forearm or even upper arm, or it can be isolated to one or two fingers. Pain is also common and can be located in the hand and forearm, and at times in the proximal arm. So CTS, that is CTS, carpal tunnel syndrome, often misdiagnosed as a thoracic outlet syndrome, but you can see the decreased sensation in the median nerve distribution. And also you can reproduce the sensation of tingling by percussing with the hammer. We call it Tinel's sign. So the reproduction of the sensation of tingling when a percussion hammer is tapped over the wrist, this is called Tinel's sign. Easy to remember, tapping, Tinel. Tapping, Tinel. When you tap here, you get that electric sensation. And the next sign is Phalanx's sign. You flex it like this. You flex it and you keep it for 60 seconds and you get the same sensation. And we call it Phalanx sign. So Tinel sign and Phalanx sign. It also produces weakness of the opposition of the thumb and the abduction. So the wrist is flexed for 30 to 60 seconds in Phalanx sign, and you see the weakness of the thumb opposition and abduction. And objectively, you can do electrodiagnostic studies that shows the slowing of sensory nerves, and the median nerve potentials actually decreased. What about the treatment? You avoid the precipitating activities like using the keyboard for a long time that produces the compression on the nerve. And you can also use non-steroidal anti-inflammatory medications. You can wear splints, and then you can also give glucocorticoid anesthesia injections right into the carpal tunnel. And there is the surgical decompression treatment. When non-surgical treatments fail, you basically release that tension in the transverse ligament. So those are the basic treatments we have available for carpal tunnel syndrome. So let me give you the most important things. Basically, it is a mononeuropathy. Mononeuropathy. It can be due to compression or non-compression. The compression, when there is an injury due to repetitive use of this area, and there is non-compression. Diabetes is the most common cause of non-compression focal neuropathy. And median mononeuropathy, I mean, there are so many nerves and there are so many compartments, but all those nerves could be involved. But here, most commonly, the median nerve is involved at the wrist. And the carpal tunnel is basically bounded by the carpal bones and flexor retinaculum. The most common etiology is injury due to repetitive use. And but remember other causes like diabetes mellitus, amyloidosis, trauma, and edema. And the classic signs of carpal tunnel syndrome are pain, paresthesias, and numbness in the distribution of the median nerve. And the palmar aspect of the thumb is involved, the index finger, the middle finger, and the ring finger, this half. The radial half is spared. So the decreased sensations in this area is a very characteristic sign of carpal tunnel syndrome. And there is like Tinel sign, tap, 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 Tinel sign. You get an electric sensation. Phalanx sign, you flex it for 30 to 60 seconds and it produces a decreased opposition of thumb and abduction. So very easy to remember and very important because it's such a common thing. You see this I see this every week because people are on computers for so many times, so many hours each day. I order electrodiagnostic testing and it shows decreased nerve potentials. And then I give them many times anti-inflammatory medications, and if it does not help, I give them injections Like steroid, I take like 80 milligrams of depomedrol. I add a little bit of lidocaine and I give into the carpal tunnel here. And if those things fail, I send them to a surgeon. Basically, those are the most important points you need to remember about carpal tunnel syndrome.